Hello, everyone, and welcome to the yet another episode of USTM Podcast. I am Mehzebin, and I couldn't be more thrilled to have you all with us today again. This is the show where we bring you conversation that really matters. Now, let me ask you a question. Have you ever wondered about the complexities of a women's health that often go unnoticed? So, today we are going to talk upon one such topic, that is abnormal uterine bleeding. And for this special conversation, we have with us a legend in the field of obstetrics and gynecology, Dr. H.K Sarma. With over 37 years of experience, he has been a guiding light for the practitioners and countless patients. Dr. Sharma, welcome to the show.
Thank you, Mehzebin. So it's my pleasure to be here and to discuss such an important matter.
So, sir, before going into the technicalities, would you like to share with us a experience from your journey, maybe a critical case where related to AUB and how you managed it?
Right. Thank you for reminding me a very interesting case, which was actually around 24 years back. I can recollect today that around 24 years back when I joined Guwahati Medical College under transfer from Silchar Medical College. Then in fine morning, I saw that when I was in round in the obstetrics and gynecology department, in the septic ward, in the floor in an extra bed, I could see one moribund patient who looked very pale, around 25 years old, young lady, and she was actually suffering from irregular and heavy bleeding for a long period, several months, and was treated in the peripheral hospitals by different minor surgeries and some medications, thinking that probably it was a miscarriage, but actually it was not. And when she was diagnosed with a case of AUB, and probably they suspected that there is some infection also, so they admitted in the septic ward. So when we investigated, especially after ultrasonography, we could find that she had a tumor in her womb. Actually we call it myoma or fibroid. So ultimately we planned for a surgery and we did an open surgery, and ultimately we found that it was not a simple myoma, then it was a malignancy. So we considered it as a choriocarcinoma, and after biopsy it was confirmed, and it's a really very virulent type of malignancy which can be fatal and which is really serious. So ultimately post-operatively we treated her with chemotherapy. Multi-dose chemotherapy, we call it IMACO, and she took 6 courses, and after that she was completely cured. And fortunately that lady came for follow-up regularly, and after 2 years she conceived and she delivered a healthy baby boy after cesarean section. And that boy was really fine, and he is now pursuing postgraduate studies, quite healthy. And his mother is also healthy. She is coming to me for follow-up time to time, even today. And really, it gives me immense pleasure that I could make her life very good. And she led a healthy life after such a problem. And really, it's a very good example of AUB.
Wow, Dr. Sharma, that was an incredible story, and it is so inspiring to see that you have made such a huge difference, like in people's life. Let's dive into our topic now. First, sir, I would like to know what exactly is abnormal uterine bleeding, that is AUB.
Right, it's a very good question really, and AUB itself is known as a full name, say abnormal uterine bleeding. So it's a bleeding which is abnormal. So actually what we consider abnormal, it can be defined as irregularities in menstrual cycle involving frequency, then regularity, duration, and also volume of blood loss. So actually for that there are some limits when we call it abnormal. So when the frequency comes at less than 24 days interval, okay, less than 24 days. So cycles are less than 24 days, maybe 15 days, maybe 20 days, like that. Then next is the irregularity, when we call it irregular. When the cycles are varying at least 8 to 10 days in the cycle days, 8 to 10 days. Say last time she had 20 days and next time it is at 30 days, something like that. So this is called irregularity. Then when we call it prolonged bleeding or flow, regarding flow, when it is prolonged more than 8 days, it continues even up to 8 days or more than 8 days. Then we consider it as a heavy flow or prolonged bleeding, right? Then what about the volume? Volume we consider when it is more than 80 ml per cycle, okay? So these are the limits. Then usually at that time when this cross, then we call it abnormal. So this may be due to many things, many conditions we get this, but these are the limits.
That's such a clear explanation, sir. Our audience will be really benefited from it. So, sir, could you walk us through what are the different types of AUB?
Right. So if you go to the types, so it can be classified especially on the causes, how from which cause it is arised. So there is a very important and very well-known classification known as PIMCH classification. So PIMCH classification gives the causes, different types of causes, and according to the causes we classify. Say P for polyp. Polyp is just a muscular growth from in the uterine cavity. And then PUM, then next is the L for leiomyoma. So it's a one kind of tumor which arises from the womb. Okay, usually it is benign, but very rare cases it can turn malignant. Then PL, PAL, then A for adenomyosis. A for adenomyosis, that is one kind of growth. Say that means uterus is growing abnormally, especially the uterus wall growing abnormally. We call it adenomyosis. It's swollen, it increases in size. So that is usually a benign condition, but it creates a lot of problem. Then what is the M? M for malignancy. Malignancy, we know it is cancer-like conditions, which is really dangerous. So these also lead to abnormal uterine bleeding. This is PUM. So these are called a structural type of abnormalities. So grossly we can divide into structural and non-structural. So then comes the non-structural. So non-structural are represented by C for coagulopathy, coagulation disorders. So our bloods are clotted. So it is a normal phenomenon. So whenever there is bleeding, it will clot by natural process. But whenever there is some abnormality there, it will not clot. So this will lead to abnormal type of bleeding. So if there is coagulopathy, that can also lead to this. Next is O for ovular dysfunction. Ovaries, we know that these are the organs which are very vital and which are responsible for menstrual cycle. So these ovaries, when goes dysfunction, that means not functioning normally, then we call it ovarian dysfunction. So that is one of the very important cause, and this is a rather commonest cause of AUB. Okay, then this is O, then I, EIN. E means endometrium. So endometrium is the lining of the uterus. So uterine lining, when is disordered and it is responsible for abnormal uterine bleeding, then we call for E classification. Then I classification, I for iatrogenic, that is induced by medical treatment. So whenever we treat a patient by different medicines or different modalities, then we find sometimes it may lead to abnormal uterine bleeding. So one example is IUCD, intrauterine contraceptive device. So this is this under iatrogenic causes. Then next is the N. N is non-classified. There are some causes where we cannot classify. You cannot put to any type of groups like this. Okay, so in that case we will put in that one. And one example we can say that in some of the cases of arteriovenous abnormalities, arteriovenous abnormalities, or that means the capillary vessels or the blood vessels were supplying the endometrium inside of the uterus. So sometimes gets abnormal, which could not be diagnosed properly by our normal modalities of investigations. And this may be an inherent cause, or sometimes there might be some causes also induced by some other things, so which are really not diagnosed in most of the conditions. So this type of cases which cannot be diagnosed, which cannot be put in any other of this classification, do we put in this group. So these are the different types, and which is internationally accepted everywhere.
This is fascinating, sir. But how common is AUB, and what are the risk factors that are related to AUB?
So really it's a pertinent question. So how common it is? So it is not an uncommon one, it's a rather common. If we see in the gynecological OPD, we can find that this, as per statistics, 17.9% cases are suffering from AUB. Of course, it depends. So if we take the statistics from referral hospital, tertiary care hospital, the incidence will be much more. But if we take all together, the peripheral hospitals, sub-centers, primary healthcare centers, then definitely it will be less because it will be diluted. So there's a gross range, we can say, from 4 to 18% of incidences, or you can say prevalence. But if we consider the different causes, then we find ultimately in adolescents, around 20% cases are from the adolescent group, and around 50% cases are in the perimenopausal, or we can say after 45 years of age. That means around the menopause, before menopause, after menopause, like that. So these are the incidences, or we can say prevalence. Then next comes the risk factor. You asked about the risk factor. Really, it's a very important one to know, because we know that there are some conditions which are really a potential risk for AUB. So one example is PID. So in medical term, we call it pelvic inflammatory disease. So these are really inflammation or infection of the genital organs, especially upper genital organs. So the part of the genital organs which are inside and which cannot be reached from below, and these are suffering from infection, then it is leading to this type of disease, and sometimes it may lead to AUB. Then next comes the malignancy, which is really a very dangerous cause, and we should always be very careful regarding this, and people are also scared of this, and really it is very important to diagnose early. So this may be a cause of AUB. Then next important one is IUCD or contraceptive. So IUCD, already I told you that intrauterine contraceptive disease. It's a iatrogenic cause. So we treat the patient, or for the benefit of the patient we are using it, but still it may lead to this type of problem in some time, not always of course. Then even OC, that means oral contraceptive pill, when it is taken injudiciously, or some patients when it is not suitable, say in some of the patients we are giving a lower dose, then there might be bleeding, we call it breakthrough bleeding. Then sometimes it may lead to some other type of bleeding, okay, continuous, irregular, something like that. So this depends. So these are all causes, or these are all risks. Then next is the medicines. Some of the medicines when we use for treatment of some of the important diseases, like one is breast cancer, we treat with a drug known as tamoxifen. Then another one is the estrogen, we use it for HRT, that is hormone replacement therapy. Then these are when treated, or when we treat in injudicious doses, or sometimes the patients go on taking it without asking the doctor, then that may lead to this type of problems, right? So these are the important risk factors, and you should always be careful about this.
That's a lot to consider. But I have always wondered, at what age women are most likely to experience this AUB?
Yes. So that already I told you that there might be already regarding incidents, I told you that adolescents and perimenopausal. So these are the most vulnerable group. But still, even in between, that means when it is in the adult and reproductive period. So during that period also they are suffered from this. But there are different causes, and causes differs. So especially at the extremes of ages, we get problems, let's say in the menopause, near menopause, and even adolescence. So in those cases, there is abnormal uterine bleeding. That means ovulation doesn't occur. That means eggs are not released, cycles are going on, and cycles are irregular. Sometimes there is no cycle. There is amenorrhea, or we can say there is cycles are missing, and at the time after that you find that there is irregular bleeding and heavy bleeding. Okay, this type of bleedings are called anovulatory bleeding, and that means ovulation is not there, eggs are not released in cycles. So during that time, chances of conceiving is very unlikely, but the patient is suffering for bleeding. But in the other group, say in between this, that means not the adolescence, not the menopausal, premenopausal. So in this time, that is the reproductive period. So they also suffer from AUB. But these are ovular bleeding. That means ovulation is going on, or the eggs are released in every cycle. The patients are very likely to get pregnant anytime. So in those cases, you should be very careful to diagnose that whether it is actually AUB or it is a pregnancy-related bleeding. So pregnancy-related bleeding, we don't consider it as AUB. So that diagnosis is very, very important. And in those groups, we always have to suspect this first. and exclude it. Okay, so these are the difference, and you know that incidence is really at the extremes are more, but still here in between, but the causes differ.
Sir, this might be a very sensitive topic for those of the viewers who are really thinking of starting a family. So does AUB affect the ability of a women to get conceive or to get pregnant?
Yeah, really is a very important question, and we are nowadays mostly we are concerned with the fertility, and the gynecologist have to deal with the fertility most of the time. And now I don't know that fertility centers are coming up. So in those conditions, say we find that patients are suffering from AUB, no doubt, but at the same time there is a concern for conception, because those patients want to get conceived, and then in that case they are having AUB also. So we have to take them in a different way, and we have to investigate in a different way. We have to treat them in a different way, not like the other patients. Because in those cases also there will be that means chances of ovulation or chances of producing egg is very important at the time, because they want to conceive. And we know that there are conditions of AUB leading to AUB, but there is an ovulation. Ovulation doesn't occur, egg doesn't release. So one very important and common condition is PCOD, that is polycystic ovarian disease, where there is an ovulation doesn't occur, eggs are not released in every cycle, and at the same time there might be irregular bleeding. Another one is a fibroid, where you find that there might be AUB. At the same time there are tumors. So tumors sometimes multiple, sometimes even a small tumor but in a bad site. So sometimes we find a tumor which arises at the end of the near the cornu, that means around the fallopian tube. That means we know that there are fallopian tubes which carries the eggs, carries the sperms, and ultimately the fertilized ovum carries to the uterine cavity. So in those conditions, if there is fibroids and that blocks that area, then there will be problems. Another one, there is a big fibroid which goes inside the womb. That means to the cavity of the womb, and in that case it will obstruct the implantation. It will not allow the pregnancy to continue. So that may be another causes. So in this way, in various ways, the fibroid may lead to infertility. That means fertility will be obstructed. Then there are conditions known as adenomyosis. Already I told you that is a condition where there is swelling of the uterus as a whole. The uterine myometrium is involved, and you find the uterine musculature or the wall of the uterus is swollen as a whole, and ultimately it will change the environment of the inside the womb, and which is not conducive for implantation or for continuation of the pregnancy. So that will also affect. There are conditions like malignancy, as I told, though they are very dangerous conditions. So there might be malignancy from different areas of the womb like cervix, endometrium, body of the uterus, even the ovaries. So in those conditions, it definitely affect the pregnancy. And not only the disease, but also the treatment of the disease will affect the pregnancy. Another one already I discussed, that ovular dysfunction is one of the very important cause of AUB. So ovular dysfunction means when there is problems in ovulation, when there is problems in releasing the egg. It may be the egg which is not produced properly. It may be the egg which is produced is not of good quality. It may be that eggs are not released properly. Okay, so in different ways there might be ovular dysgenesis. That means ovulation is not going on properly. So in that condition, definitely it will affect the pregnancy. So these are various ways. So there are other causes, of course, but AUB related causes are this mostly.
Thank you, sir, for addressing that so sensitively. I'm sure that a lot of our listeners are reassured after listening to your answer. Now, there's $1 million question. Sir, what lifestyle changes one can make to manage AUB?
Thank you for asking this question. Really, it's a very important and helpful question for our audience. So we know that there are two categories. So some persons are already suffering from AUB, and the other who don't want to suffer from this. So those who are already suffering, for them there are important tips. That means there should be some changes in the lifestyle. That means while they are suffering from the disease, they should be having proper rest. That means while they are having bleeding, so they should not go for strenuous work. They should restrict their mobilities, or if they are doing some works which demands some more physical activity, so they should restrict to that. Okay, so that type of rest is very important at a time. Otherwise, treatment will not be very much effective at the moment. Next is the diet. So regarding diet, they should be very careful. So always they should take some diet which are rich in iron, rich in protein, rich in vitamin, because they are having already deficiency, because blood loss for prolonged period or prolonged heavy amount of blood loss leads to iron deficiency anemia. So they are deficient on iron. So iron rich diet they should take. They should take protein rich diet, and they should take vitamin rich diet. So good diet is very, very important, so that they can cope with the problem. The next, another one is the hot fermentation they can use. Sometimes there might be some problems which lead to pain also, cramps also to be there. So for that they can use that one. Then another category already I told you, that means that is for prevention, which is really very, very important. So for prevention, they should always lead a healthy lifestyle. So healthy lifestyle already we know that they should have proper rest, proper sleep, okay, then proper food or diet. They should take good diet which is not disturbing the internal environment, okay. They should avoid substance abuse. That means they should avoid smoking, avoid alcohol, then avoid substance abuse, all these things. And another one is the regular exercise or an active life is very important. It is not necessary that everywhere you have to go for a very vigorous gym or this work. It is not at all necessary, but only thing is that very active life. They should maintain an active life, and whenever it is not possible, they should go for some sort of exercise, but regularly. Maybe for 10 minutes, 15 minutes, but regularly they should do. That is very important. And good sleep and avoid stress. These are all very important. To avoid stress, they can go for meditation, and they should go for yoga. So that will also help in this manner.
Dr. Sharma, before we wrap up, what message would you like to share with our audience, especially the younger generation, for the prevention of EOB and maintaining a healthy gynecological health?
Thank you. Really, it will be very important for all the viewers that they should know these important tips. And already we have mentioned all these things, said that a lifestyle which is healthy, that is always very important. And for that, adequate rest and adequate sleep is really important. And for that, whatever is needed, that already you know that for adequate sleep, how to go for that. So this I am not going to elaborate much. Then next is the regular exercise. Already I have mentioned that not necessarily a very vigorous exercise, but some sort of exercises which are done regularly is expected, and to maintain an active life. Then next will be the avoiding stress, that already mentioned. That is also very, very important, because avoiding stress will indirectly affect the brain, which is also controlling all these this means systems, endocrine systems, or the systems of menstrual cycle. So for that, meditation is a very good thing, and that can avoid all this type of thing. And yoga is definitely important. And regarding diet, it should be a good diet. Good diet, already you know that diets which are not refined cereals are not good. Then unrefined, unpolished, then those who are not having much of the insecticides and all other things, that means organic women, then not very spicy, okay. And these things should be done. And junk food should be avoided. And we know that substance abuse is a very dangerous thing that should be avoided always. There should not be smoking. Alcohol should be restricted. Then another one is the medical one. That means medical aid. So regarding medical aid, one is regular screening. That means regular health checkup is very, very important. So in that case, we can detect many of the conditions at the right moment, and we can treat it. Then another one is vaccination. Nowadays vaccinations are available, especially for malignancy like carcinoma cervix. We have vaccines today, and all the young girls above 9, they should take this vaccine. So that can avoid this type of dangerous disease. And there are some other things like managing other we call it comorbidities. That means these are medical disorders. So which can lead to abnormal uterine bleeding. Say one example is thyroid disorders. There might be hypothyroid, hyperthyroid. Then another one is the diabetes. Then another example is hypertension. So this type of diseases should be always checked.
Dr. Sharma, thank you so much for such an enlightening conversation.
Thank you for inviting me to such a very important discussion. So I want to give just one line message to all our viewers to avoid all these type of problems. Yes, they should maintain healthy lifestyle. Then they should be health aware. Then they should consult. Everyone should consult a doctor at the earliest moment. Thank you.
Thank you so much, sir. And to our listeners, I hope today's discussion has given you valuable insight. If you enjoyed this episode, do not forget to like, share, and subscribe. Till then, stay healthy, stay safe. Thank you.